Why do we get headaches? A headache is one of the most common ailments, something nearly everyone has experienced at some point. It can be mild and fleeting, or it can be so debilitating that it disrupts your entire day. But have you ever wondered, why do headaches happen? What's actually going on in your head when it feels like there's a tiny orchestra of pain pounding away? Let's unravel the mystery behind headaches, from their causes to the different types, and even how to prevent them. What is a headache? A headache isn't your brain hurting, contrary to what it might feel like. The brain itself lacks pain receptors, so where does the pain come from? Headaches occur when pain-sensitive structures around the brain, such as nerves, blood vessels, or muscles, are activated or irritated. These structures send pain signals to the brain, creating the sensation we interpret as a headache. Types of headaches. There are more than 150 types of headache, but they generally fall into two main categories: primary headaches and secondary headache. 1. Primary headaches. These are standalone headaches not caused by an underlying condition. They include tension headaches, the most common type, often described as a band of pressure around the head. They're typically triggered by stress, poor posture, or muscle tension. Migraine, a complex headache often accompanied by nausea, sensitivity to light and sound, and even visual disturbances. Aura. Migraines can last for hours or days and can be incredibly debilitating. Cluster headaches. Intense one-sided headaches that occur in clusters over weeks or months. They're rare but known for their excruciating pain. 2. Secondary headache. These headaches are symptoms of an underlying condition, such as sinus headaches, caused by inflammation in the sinuses due to infection or allergies. Medication overuse headaches, also called rebound headaches. They occur when pain medications are used too frequently. Serious causes. Conditions like meningitis, brain tumors, or aneurysms can also cause headaches, though these are rare. Why do headaches happen? The causes of headaches vary widely depending on the type. Let's dive into some of the most common reasons. 1. Tension and stress. Stress is one of the biggest culprits behind headaches. When we're stressed, our body releases hormones like cortisol, which can lead to muscle tension, especially in the neck, shoulders, and scalp. This tension can compress nerves and blood vessels, triggering a tension headache. 2. Dehydration. The human brain is about 75% water. When you're dehydrated, the brain can temporarily shrink, pulling away from the skull. This action can irritate surrounding nerves, causing a dehydration headache. 3. Diet and hunger. Have you ever skipped a meal and ended up with a headache? Low blood sugar levels can trigger a headache as the brain struggles to get enough energy. Certain foods can also be triggers, including processed meats containing nitrates, aged cheeses with tyramine, caffeine, too much or withdrawal. 4. Sleep problems. Lack of sleep or too much sleep can wreak havoc on your body, including your head. Sleep deprivation disrupts neurotransmitters in the brain, increasing the likelihood of a headache. Conversely, oversleeping can lead to weekend headaches, especially in people prone to migraines. 5. Changes in blood flow. Many headaches, especially migraines, are linked to changes in blood flow to the brain. During a migraine, blood vessels in the brain may constrict and then dilate, causing a pulsating pain. 6. Environmental triggers. Bright lights, loud noises, strong smells, and changes in weather, especially barometric pressure, can all trigger headaches, particularly migraine. 7. Hormonal fluctuation. Hormonal changes, particularly in women, can play a big role in headaches. Many women experience migraines linked to their menstrual cycle, pregnancy, or menopause due to fluctuations in estrogen levels. 8. Underlying conditions. As mentioned earlier, some headaches are secondary to medical conditions. Sinus infections, head injuries, or even high blood pressure can all lead to headaches. It's always important to consult a doctor if your headache feels unusual or is accompanied by other symptoms. What's the deal with migraines? Migraines deserve special attention because they're more than just bad headaches. They are a neurological condition that affects millions of people worldwide. While the exact cause of migraines isn't fully understood, researchers believe it's related to a combination of genetics. If migraines run in your family, you're more likely to experience them. Brain chemistry. An imbalance of neurotransmitters such as serotonin may play a role. Hyperactive brain. In people with migraines, the brain may overreact to certain triggers, leading to changes in nerve signals and blood flow. Migraines often have 4 stages. Prodrome. Subtle symptoms like mood changes or cravings that appear hours or days before the migraine. Aura. Visual or sensory disturbances, such as seeing flashes of light or feeling tingling sensations. Attack. The headache phase, often accompanied by nausea, vomiting, and sensitivity to light, sound. Postdrome. After the headache subsides, people may feel drained or hungover for hours. Why are some headaches so intense? The intensity of a headache depends on the type and cause. For example, tension headaches are generally mild to moderate. Migraines can range from moderate to severe and may incapacitate you. Cluster headaches are so painful they're often often nicknamed suicide headaches because of their intensity. The level of pain is related to how much the nerves, blood vessels, or muscles are irritated and how sensitive your pain pathways are. In some people, the brain's pain signals become overactive, amplifying the discomfort. How can you prevent headaches? While not all headaches are avoidable, there are steps you can take to reduce their frequency and severity. 1. Manage stress. Practice relaxation techniques like yoga, meditation, or deep breathing. Take regular breaks during work or study to avoid tension buildup. 2. Stay hydrated. Drink plenty of water throughout the day. Avoid excessive alcohol or caffeinated beverages as they can dehydrate you. 3. Eat regularly. Don't skip meals and maintain a balanced diet. Identify and avoid food triggers if you notice a pattern. 4. Get quality sleep. Stick to a consistent sleep schedule, even on weekends. Create a sleep-friendly environment, dark, quiet, and cool. 5. Limit screen time. Staring at screens for long periods can cause eye strain and tension headache. Use the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. 6. Track your headache. Keep a headache diary to identify triggers and patterns. Note the time of day, foods eaten, stress levels, and other factors. 7. Seek medical advice. If you have frequent or severe headaches, consult a doctor. Treatments like medication, physical therapy, or even cognitive behavioral therapy, CBT, can help. When should you be concerned? Most headaches aren't dangerous, but some can signal a serious problem. Seek medical attention if you experience a sudden, severe headache, often described as the worst headache of your life. Headaches accompanied by fever, stiff neck, confusion, or vision changes. A headache after a head injury. Chronic headaches that worsen over time. Conclusion: the puzzle of pain. Headaches, while common, are incredibly complex. They can stem from something as simple as dehydration or as intricate as changes in brain chemistry. Understanding why they happen is the first step toward managing them effectively. So, the next time you feel that familiar throb or ache, take a moment to consider what your body might be trying to tell you. Is it stress, lack of sleep, a skipped meal? By paying attention to the signals, you can work to reduce their impact and maybe even prevent them altogether. Found this article insightful? Give it a like, share it with someone who battles headache, and follow us for more fascinating explorations of the human body and mind. What's your go-to remedy for a headache? Drop it in the comments below. We'd love to hear your tips and tricks.